Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine, or I'll talk on a particular topic for individuals, society, and the world. And today I have a kind of a mix situation where I'm interviewing someone, but they decided there was a Dr. Makoto Abui, an MD, PhD from the Miyagi Cancer Center in Miyagi, Japan, and he just felt his English wasn't good enough to do an audio video um, interview. So he wrote the answers to my questions, which are below, and you'll be able to read them. But I thought I would give a summary of his work. And so the title was Repeated COVID-19 Vaccination as a Poor Prognostic Factor in Pancreatic Cancer, a retrospective single center cohort study. So you can get kind of the drift of the study is that repeated vaccinations resulted in poor outcomes and survival times in pancreatic cancer patients. And so Dr. Makoto Abui, he's an MD, PhD, as I mentioned. He is the chair of the department or head of the Department of Gastroenterology at the Miyagi Cancer Center, and he belongs to all the local gastroenterological societies. And what he did was he noticed that in 21 and 22 that the survival of his pancreatic cancer patients, they weren't doing as well, the overall survival. And his passion in life is to extend the life and treatment and quality of life of pancreatic cancer patients. And everything was improving and doing well up to through 2020. But in 2021 and 2022, um, the outcomes weren't doing as well. And so he thought, like many people, what else has happened during that time? And that's when mass vaccinations were happening. And in Japan, they're very strict, and many people have, three, four, and five vaccinations. And so the public health officials didn't have any data on this, and they weren't very helpful. So he decided to do a study on his own, and he took 272 pancreatic cancer patients, and he followed them, and 96 of those cancer patients had IgG4 levels done. So they followed the frequency, the number of vaccinations, how long they lived, and then they also correlated it with IgG4 levels. And the reason that's important is vaccines have been known to increase the IgG4 levels, and the IgG4 levels can relate to immune suppression. It can also be either inflammatory or anti-inflammatory, but they could lead to immune suppression. And that might be a reason why the multiple vaccines increase the risk to poor outcomes in the cancer patients. And they also measured not just IgG4, but also the IgG4 to the spike protein. The spike protein is the little spike on top of the ball of the virus that you see. Um, the messenger RNA, the injection, is really gene therapy, and it tells your body to make the spike protein. And it's an altered spike protein. And it's not like the spike protein that comes from a natural infection, which goes up and then comes down and leaves the body. This spike protein, we don't know how long it will last in the body and continue to be made because it's been altered in its structure, its genetic structure. So what they found out was, again, those people had more vaccinations, had higher IgG4 levels, and they did more poorly. In fact, those, he says, who have three or more COVID vaccinations had a reduced overall survival. And of course, that's very distressing. And when you ask him, would you recommend COVID vaccinations to his pancreatic cancer patients or cancer patients in general? And he said, well, he can't make public policy, but if it was up to him, he would not recommend uh, his pancreatic cancer patients or anybody with a solid tumor to get the COVID vaccines. And again, the undercurrent is, public health officials almost around the world just do not want to answer the question, are these vaccines harmful? Which many people, including myself, think they are. The spike protein is one of the most toxic compounds ever. It is a very, from vascular health to inflammation in the body, um, increases risk to possibly cancer. We know it increases the risk of blood clotting. Some people believe it increases the risk to neurodegenerative diseases. Others say it relates to female fertility issues. So the moral of the story is that if you have cancer, I wouldn't recommend getting a vaccine, and that's kind of the flavor of uh, this article. And again, you can read the details of this article below. They're excellent. He does an outstanding job. If his English is half as good as the way he writes, then he could have done the interview, but I respect that. So my name is Kirk Hamilton. This is a Staying Healthy Today show. The printed interview is below and all the links. And I hope you have a nice day, and we'll talk to you soon.